This video will instruct trauma and SANE SART staff on the new depart process. With the new depart process, multiple forms have been reduced to 2 items: IV stop times and disposition documentation. Please remember that when documenting IV stop times, this is for infusion billing only. The source of truth for all medication administration is the MAR and is what is referred to when any issues arise. The following screen is simply pulling information documented in the MAR. Effective immediately, all IV medications are required to have at least 1 minute inserted within the infused over section of the MAR during documentation of medication administration. Once the MAR is accurate, all information will be pulled into the infusion billing. Once IV stop times have been completed, the next tab is the disposition documentation. This form has conditional logic. Additional questions are presented based on the user's selections while completing the form. Please be aware that when you are documenting vital signs within this form, that the pain portion is listed on the left in a separate tab. The assistant summary only needs to be completed in the following situations. If you have assisted with a non-ED physician while the patient was in the emergency department. This would include EMTALA, trauma, or orthopedic consults. If you assisted any ancillary staff such as social work discharge planners or other hospital support while the patient was in the ED. If you performed additional work to manage a significant behavior issue that required frequent or ongoing one-on-one attention of nursing ancillary or support staff. If you performed additional work to obtain past medical records. Visit type form, which used to live at the bottom of the ED nursing assistant summary, is now pulled out and placed face up. Please consult the FirstNet Workflows notebook, which is in each charge nurse's desk, for selecting the correct visit type if it varies from a standard encounter. In the Discharge To box, based on the user selection, prompts an additional form to be completed. Once this form has been started, it must be completed in its entirety. Saving the form and restarting the depart process will create a blank form which will require you to re-enter all your previous information. If the patient is being admitted, the following screen will appear. Please complete the appropriate boxes with special attention to the following areas. When documenting report given to, please include the room or location in which the patient will be going to. When verifying allergies, please remember that the allergy band, not sticker, needs to be on and verified. If the patient is being discharged, the following screen will appear. The information being asked to document is the current information we are gathering now. All other information from the previous form has been removed. At this time, we are not collecting the amount of time spent in teaching. If the patient has expired, the following form will appear. Please complete this form in addition to the expiration form, which can be located in the ad hoc section. If the patient is being transferred, the following form will appear. Please remember that the paper transfer form still needs to be completed due to the fact it requires a patient signature. When departing a patient before they have received the final disposition, please complete the AMA LWBS section. You will need to select in the Discharge To area. If the patient leaves against medical advice or elopes, please select Left Against Medical Advice. If the patient leaves before being seen by the triage nurse, please select Left Without Being Seen. Then in the AMA LWBS section, please complete the information and leave a comment in the AMA LWBS section. No additional ED nurse note is needed. Once you have completed your disposition documentation, then you may select either Admit or Discharge Transfer to complete the process. Please remember the Admit button indicates that the medical record or encounter will be continued within the Via Christi system. The Discharge Transfer button indicates that the medical record or encounter will be ending. These changes will be effective Monday, September 13th, 2016, with the conclusion of the conversion process earlier that morning. This concludes the Depart Process video for Trauma, SANE, SART.